Good afternoon, friends. I want to begin a discussion about developing our listening skills and empathy, which provides the healing balm for so many. Paul Tournier has written in one of his volumes, I began to see that there are several ways of listening. You can listen in order to reply, or you can listen in order to hear. Listening in order to reply is what we do constantly. Often, in fact, we only half listen, more intent on thinking about our reply and looking out for some remark which would give us the opportunity of a clever answer, of saying what we want to say. True dialogue means listening not in order to reply, but in order to share in one's emotional life. True or false? Listening is a passive process. Listening is just sitting and hearing someone's story. Listening requires that you be able to hear small changes in thoughts, feelings, and behaviors. Listening asks that you walk in the other person's shoes. Active listening demands serious attention to empathy. We've talked about and raised the important word of empathy and how our work involves empathic attunement. What is pastoral presence? It involves 4 key ingredients: empathy, unconditional positive regard, which sometimes is referred to as non-possessive warmth; congruency, which is sometimes referred to as genuineness; and acceptance. These are the hallmarks of our work. Now, what is the difference between hearing and listening? Hearing is mostly one way, whereas listening is dialogical. Our work as pastoral caregivers is setting the scene for connecting. You may often hear folks talk about, well, I just don't feel connected to that person. Well, in our pastoral work in the acute care setting, we are doing the best that we can to set the scene for a connection. Emotional, spiritual, psychological connection. And our thesis is going to be this: the best pastoral caregiver is a focused listener. Why? Because that is the balm of Gilead. Are you ready to listen? Listening is hard work, requires heavy concentration and committed energy, can cause fatigue. We're not saying that you have to listen 100% of the time. And if you're not ready, if you're distracted by either a task at hand or some other problem, please let your speaker know that you're not fully attentive. That is the fair thing to do. Now, in pastoral listening skill clusters, we have 3 of those: attending skills, following skills, and reflecting skills. Let's look at skill number 1, attending. By definition, attending is giving your physical attention to another person that demonstrates your belief in their value and worth. Attending is 85% of the listening process. Attending is nonverbal. It can go as high as 90. Attending involves a posture involvement. That's relaxed alertness, facing each other squarely, maintaining an open position, and not invading that other person's personal space, and avoiding any distraction, gestures, or motions. Attending involves appropriate body motion. By attending, we are setting the scene for effective listening. Attending, of course, includes positive and comforting eye contact, creating a non-distracting environment. If the TV is on, that is going to be a distraction. If the alarm is going off on the IV pole, that is going to be a distraction. Attending. Skill number 1. Skill number 2 is following skills. Following skills involve getting out of the way. One of the primary tasks of the chaplain associate is to stay out of the way so that the chaplain associate can discover how patient views his or her situation. That's the way, we are there to understand how the patient views their suffering and situation. Following skills involve encouragers or conversational DOs, door openers. And they're non-coercive invitations to talk. Encouragers include the head nods, the open gestures, the positive facial expressions, and or comments that encourage the patient, family member, or staff person to keep talking or sharing their story. Encouragers typically have 4 elements: description of the body language, invitation to talk, thank you for letting me visit with you, attending, which we mentioned in the previous section, and silence. Silence is an encourager. Lots of times we will talk when there's silence. Encouragers only affect the direction of the conversation minimally. Patients are simply encouraged to keep talking. Encouragers are part of this package of what we call listening skills. 3 of the most common encouragers are following statements are: say more, or what do you mean about, or could you say a little bit more about that? Why? Encouragers, we encouraging folks to tell their story. Why? Because you want them to tell their story, their narrative of their crisis. You are to get out of the way so you can view that story from the patient's point of view. Following skills certainly involve questions, but what about questions? What about the interrogative? We have to use them in a conversation because the pastoral conversation is our tool. Questions are essential to gathering information, but develop the skill to use them infrequently. Look for ways to turn questions or probes into statements. How? Repetition. Read this. How? Repetition of 1 or 2 key words that the patient gives you in conversation. Let me repeat that. Repetition of 1 or 2 key words that the patient gives you in conversation. Example. I feel like my life is falling apart. I'm here in the hospital with this illness and my kids are at home without me. What is God trying to do with me? Life is not fair. Life does not make any sense. Sometimes I feel like spitting in God's face. All right, if you were to practice your listening skills, how would you respond? What key words do you hear? What key words would you respond to with the inflection of it being a question? One might be falling apart. And you say it like you're asking a question, but you're not. You're just repeating back 2 key words. That can be an encourager to deepen the conversation. How to turn questions into statements. All right. One of the ways that you can do this is to make observations about physical facts. For example, there are tears in your eyes. The seems to be statement. That's been a standard around for a long time. Rather than a question, why are you upset? Just simply make a statement. You seem to be upset. Or a statement about a clarification, such as if the conversation has become somewhat cloudy or confused, you can just simply make a statement like, I'm not sure I understand. All right. Comment on the emotional state of the speaker. What are the primary emotional states? There are 4. And mad, sad, glad, scared. Mad, irate, furious, annoyed, upset. For instance, like depending on the intensity of the emotion, dictates which word you might use. If they're deeply sad, then that might be depressed. If they're just having a bad day, they might just simply be down. So the primary emotional states, scared, nervous, anxious, terrified, need to familiarize yourself with these. These are your clues to developing your emotional feeling vocabulary. Then comment on the process you feel inside. If I were in this patient's shoes, what would I be feeling? Then use that as a resource. Of course, do and say the obvious. If you see something, acknowledge it. All right, some questions you do ask as we move along with our visitation and working with families. May I come in? Is this a good time to visit? What brought you to the hospital? Questions for information and get acquainted. We will use questions. Again, I'm trying to share with you some ideas about how to turn those questions into statements and feel like less a probe and more like a genuine conversation. Tell me about about your family support while in the hospital, about your pastoral support. And you can think of other examples that you can use to develop rapport and the experience of empathy in setting the scene for connection. Questions help begin the pastoral conversation. How have things been since you've been admitted to the hospital? Questions help elaborate and enrich the client's story or the patient's story. Can you tell me more about that? How do you feel when that happened? Given what you've said, what would be your ideal situation? These are some clues. What might have we missed so far? What comes to mind? And so they're other in their use. Questions help bring out concrete specifics of the client's world. One of the best open questions is to ask, can you give me an example of what you're talking about? In cross-cultural situations that we need to keep in mind, questions can promote distrust, for instance, like in the Asian and Latino population. So keep these thoughts in mind as you move forward. Let's practice some of our listening skills that we have studied thus far. I'm having problems at home with my family. Okay, pick it up on keywords, family, having problems. All right, the second, my son can't seem to get himself together. He stole from us last week. He cannot seem to find a job. All he wants to do is drugs. He's a sorry addict. My wife kicked him out of the house last week. Kicked him out. So you get the idea here of what I'm trying to help you discern. Well, it's been great to share with you about these listening skill clusters of attending and of following. And I trust that you will begin to use these in your work of being a great pastoral care giver.